Good morning, everyone. Thank you for having me here. My name is Dr. Kumar Anupam. I'm from Gaya. This is my third time at AMC, and I'd like to thank sir for having me here. So, we started doing navigation in 2017. When I was at Delhi, I was a JC, junior consultant, along with my boss. Navigation just came in, and we did some 200 cases. I have very fond memories, and I like that system since then. So, this is the era of robotics. And we are discussing navigation. Does it still stand a chance? That's the question to delve. So why we are discussing? Why robotics? Why navigation? Because a lot of our patients were unhappy. Historically, that figure was 20%. Latest literature review put that at 10%. I think that was published in CORR 2022, Skadiri. So why are patients were unhappy? A lot of things have changed in joints over years. I think apart from changing the implant design, conformity, material, we are still struggling with how we get around so that that 20% subset is still, we get them happy. So we started with mechanical alignment, still the gold standard. But then in this era today, now navigation and robotics, we tried kinematic, restricted kinematic and all that. So where does that bring us? And that's where our navigation and robotics come into being. So the cause, as far as we have discerned, is that every knee is different. Every knee is not the same. The patient's anatomy is different. And what we were forcing is a fixed angle over every knee. We were forcing fixed valgus. We were forcing fixed rotations, 3 degree, 5 degree, as the jigs were coming in. So it's not that that's not the case with everyone. So if somebody is walking with a bit of a bow and then you force a plumb 0 degree axis to him, so that patient is going to complain that I was not walking this way and now you're forcing me to walk. And that's the cause. So fixed jigs where you have fixed 3 degree rotation or 5 degree rotation, fixed angle. So that's how the concept of digital orthopedics came into being. To make that subset happy, to make the feel of knee more natural. So digital orthopedics started with the navigation, then the design of augmented reality, virtual surgeries, and at present, robotics. So coming to navigation, what it is, basically it's a high-speed camera which tracks the position of your knee. You have a processing unit, and then you have a screen where the surgeon can interact, give directions. It's just like using Google Maps. I think all of us use Google Maps. So on Google Maps, you are being tracked by satellites. You put in your data from where you have to start, where you have to go. So that's like registration. You register in imageless systems or with image-based CT systems. You register your landmarks, and then you navigate your way through. You reach your destination. So it's just like Google Maps. So this is a video from one of my cases which I did a couple of days ago. Mapping my tibia condyles, just showing you a snapshot. Mapping my medial and lateral tibial condyles in the ankle and all. You can see the optical trackers which are there. I'm using a Stryker system. I'm still using it. So how does it help? So instead of putting in that fixed angles, I can alter my varus and valgus. I can give flexion or extension to component. I can give rotations. I can do AP shift. I can downsize, upsize, everything. Everything which you are able to do in robotics. It's just that robotics have an added arm. Navigation as well failed because there were certain causes to it. So an arm was added, a haptic feedback was added, virtual boundaries were added. So navigation is like the grandfather of robotics. It's not, that's the case. That's how the digital orthopedics is progressing. And navigation is still here to stay, I suppose. There are many people who are still continuing with it. In fact, there has been a resurgence and redemand for navigation world over after this era of robotics. Why? I don't know. Maybe people wanted to take a step back and reassess what went wrong with navigation. In fact, in many countries, especially a company called Pixie. An augmented reality system was launched from France. We did try that. Here, it's a kind of navigation only, but you wear smart glasses and everything gets projected on your axis. We're one of the first centers where this was tried in East India. There are homegrown companies like HRS Navigation who are relaunching this system. It's an open platform. You can use all the implants. I think even Stryker is relaunching. They have relaunched OrthoQ in US. So there has been resurgence. So yes, can navigation stay? Or in that question, even robotics, fewer question, even robotics, whether it's giving a good outcome as far as PROMs are concerned. So a study, meta-analysis, they assessed all the outcomes, whether navigated was superior to robotics or robotics was superior to navigated, and patient-specific instrumentation as compared to conventional systems. And as with all the papers at present, no decisive outcome. But if we have things to ponder about, maybe our patient-related outcome measures are not that objective yet that they are able to detect that early satisfaction. Yes, patients do report less pain, early mobilization with robotics and navigation. So maybe our PRM scores or a system has to change, or maybe we are not doing that great in navigation robotics yet, and we have to maybe improvise more. Digital orthopedics at the cost of our dexterity. Yes, as surgeons, we are getting less, I think, adept to our deformities now than we were earlier, because we leave a lot for the computer to calculate. So I'm not sounding like, maybe I'm not sounding like professors, but yes, I think we have to keep our dexterity in hand as well, because it's not that in every case we can use navigation and robotics. But it did give us an advantage of process standardization, in the sense that a surgeon who has done 5,000 cases is very well adept, and somebody who has just started, maybe that erring in your initial phase, that can be controlled by your navigation and robotics. But then again, a question of cost effectiveness. Can we justify that cost? Few studies say yes, few say no. So that's again a challenge as well, because yes, these things have a significant additive financial impact, especially at places like us in Bihar, where patients don't even agree for a TKR. Like sir was saying in his initial presentation, that my own relative, she's waiting for another fracture to come and then she'll go in for a TKR. So yes, we have that kind of a market. So adding on to this thing, marketing and make or break good stuff. Ours is an industry-driven specialty. There's no denial. So good things come and they go away as well. So that has to be kept in mind as well. So I don't think so that navigation can be washed away straightforward, or it's the end. Of course, robotics is going to grow and maybe more autonomous systems have to come. But then again, I'll leave my last question to you all. Do you believe that if you do a good conventional TKR and instead of didactic jigs, I give you adjustable jigs like say Stryker system, where you dial in your rotations and slope can be adjusted in everyone. And if I give you a pre-op CT and I give you values that my rotation is not 3 degree, my rotation is 5 degree, and my slope is this. So will you be able to give a equally good result? I think that might be true. So to finish that, what our patient want is their ability to walk. They don't know whether a robot is operating or navigating, or a navigation system is working on the back. They know you, they know your face. What they want is a pain-free, stable knee. They want to walk normally. So whoever is behind, I think it's the surgeon's call. So a lot of things to ponder, and maybe time will take us through, as they have taken us from 1980s till this 2024. The joint surgeries have gone on and they have improvised so much. So with that, I'll finish my talk. Thank you.
Thank you, Dr. Anupam Kumar, for your nice oration. Now it's turn for Dr. Ratnesh Singh. Please come on the dash, and he is consultant and orthopedic surgeon in Paras Hospital, Patna. He will give oration on the total knee replacement in severe valgus knee. Thank you.